Hi, my name is Brenna Summa, and today I'm going to be presenting on breastfeeding and skin-to-skin contact. This is both a passion of mine and it's my profession. I currently work as a labor and delivery nurse, and one of my primary roles is to promote this method at deliveries and during my daily routine. So I'm going to share with you today the knowledge that I have learned from the research that I have done during this program, and show you how I'm going to educate nursing staff to assist in making this a standard of practice. So first of all, what is skin to skin and why is it so beneficial? Skin to skin is going to be positioning of the baby upright on the mother's bare chest. So right at delivery, an infant's going to come out, go skin to skin on the mother's chest. This is going to promote the optimal environment. It's going to help in the bonding and promoting early breastfeeding. It also helps promote temperature regulation and blood glucose stability in infants. So part of the study that I did, I found some research that stated that infants kept on the mother's chest for at least 20 minutes after the delivery, breastfed for almost a month and a half longer, and then weaned off of breastfeeding about 2 months longer than those that had no skin-to-skin contact at delivery. During deliveries, the nurse has a primary role of taking care of the mother. However, an infant is going to become a primary responsibility as well. Having an additional staff at the bedside, such as a nursery nurse, is going to help promote making this a best standard of practice. You're going to have your primary nurse that's caring for the mother, assisting the physician in whatever needs to be done to take care of her, but you have a delivery or a nursery nurse who's going to be there to help with the infant at all times. She's going to be there to encourage that skin-to-skin contact and help maintain that bond with that mother and newborn infant. For my research question, my PCOT question consisted of, in neonates, how does skin-to-skin contact, also known as kangaroo care, compared to traditional practice, affect breastfeeding rates and temperature control within the first week of life? So my patient population is my neonates. My intervention is going to be skin to skin. My comparison is that of swaddling. The outcome is going to be temperature control, and the time I've estimated about the first week of life. Education is very key with this standard of practice. Having nurses understand the difference between skin-to-skin contact and swaddling is going to become their ideology of how they're going to make this practice possible. Skin-to-skin care, or kangaroo care, was developed in Bogota, Colombia, when radiant warmers were not available. So this was an alternative method to helping their infants, and they realized it was very beneficial to both mom and baby. In my literature review, I used the Sentinel database, I used professional websites and professional journals. Some of the professional websites I used was UNICEF as well as the World Health Organization. The professional journals I utilized consisted of the Journal of Midwifery and Women's Health as well as International Breastfeeding Journal. The summary of my literature, after reviewing 2 articles in great detail, the conclusions I found was that skin-to-skin contact promotes bonding, breastfeeding, and improved health in a preterm neonate. It also helps with the reduction of hospital length of stay for an infant in a neonatal intensive care unit. Skin-to-skin contact helps with stability and thermoregulation of blood glucose levels. It's helped maintaining the infant's blood pressure, their respirations, their heart rate, and helping make sure if they have that breastfeeding initiated right away, their blood glucose levels are not dropping rapidly. It's also shown to have a decreased risk in postpartum hemorrhage and cost savings, $13 billion a year related to mortality and morbidity reductions in the United States just by promoting skin-to-skin contact. Not only is this a practice that is going to help promote bonding and breastfeeding, it is a cost-saving measure as well. In a 2010, 11, and 12 Cochrane review, the method of skin-to-skin contact within the first 10 minutes of life was the fastest method proven to keep a newborn warm. In the first 24 hours of life, it is shown to promote thermal stability and increase breastfeeding rates. Along with decreased postpartum hemorrhage, it has a decreased risk of having women develop postpartum depression as well, with you have that bonding initiated right at birth. So the benefits of skin to skin. There were some guidelines that I found in my research that stated that the establishment and maintenance of breastfeeding was a very good guideline. So beginning at birth, you're going to check your infant for response of breastfeeding every hour and encourage your mom to breastfeed every 2 to 3 hours. You can have infant physiology and thermoregulation and neurobehavior. This is going to be a benefit. It's going to help with the skin contact, regulate key factors at the infant's birth, like the vital signs, which I recently just talked about. The literature that was composed to form these guidelines came from the Cochrane Pregnancy and Childbirth Group. The goal of the guidelines was to assess the effects in early skin-to-skin contact compared to traditional practices of swaddling. This was a 4 to 6 month period of assessment and evaluation, which showed results of increased breastfeeding in these babies compared to those 45 days longer that did not receive skin-to-skin contact at birth. And one of the other initiatives of skin-to-skin contact is that maternal-infant bonding and attachment helps with that as well, like I've previously stated. The recommendations that I found from my literature, the first thing that is recommended is to determine if your infant is stable enough to initiate skin-to-skin. Your infant should come out after delivery, drying them immediately, of course, then seeing if your infant is responding with color. If your infant is not turning pink, is maintaining blue, especially around the mouth, they're not crying spontaneously, this would be an indication to take your infant over to the warmer for further assessment. You would not be able to initiate skin-to-skin at that time. However, once your infant becomes stable, you can then bring them back to mom, bare skin on her chest, and then begin that contact with her. You're going to monitor the effectiveness of your skin-to-skin. So sometimes during a delivery, your infant might be positioned the correct way. Your mom is going to move around. Things are going to happen and the infant's not going to be the right way anymore. You need to make sure that position is maintained, keeping the infant dry at all times. Remove all wet blankets, soiled blankets, and keep a hat on the infant's head. Infants are going to lose the most heat through their head, so by keeping a little bonnet on that, that's going to help with that thermoregulation, as well as mom being able to regulate that as well. You want to make sure that your mothers are getting educated on skin-to-skin contact and how you're encouraging this. This should start on admission. So when your patients come and get admitted, you want to discuss what you're going to plan to do during their delivery. So educating her on this is going to help you initiate this at delivery. And then of course educating the family members as well. During the delivery, you have everybody there that wants to hold the baby right away. When can they hold the baby? How much does the baby weigh? How long is the baby? You want to make sure that everyone is educated and on board with the skin-to-skin contact so that mom and baby can bond and mom can initiate that breastfeeding right away. And one thing I always tell my patients is breastfeeding is free. It doesn't cost any money and formula is very expensive. So let's test your knowledge and see what you know. So let's identify 3 benefits of skin-to-skin contact. The first one's breastfeeding. What does breastfeeding do? You're going to have increased rates of breastfeeding. It's going to help bond with the baby. What's the second benefit of skin-to-skin contact? Temperature control. It's going to help with that thermoregulation, making sure your infant's not getting too cold and needs to be separated from mom. It's going to improve their breathing and their respirations. It's going to help slow all of that down so they're not unstable. The third thing, glucose levels. Infants that come out very large in size have a problem struggling with their glucose levels. They need to have their sugars checked frequently and sometimes need to be supplemented with formula if they're not getting enough breast milk. So if we can encourage skin-to-skin contact, we might be able to help maintain those glucose levels. Stability, like I just said, and improve feeding habits and patterns. Like I previously stated, with breastfeeding, you want to make sure that you're initiating it with mom and checking to make sure she's feeding every 2 to 3 hours. This is going to help with the breastfeeding habits and patterns of that baby. Well, I hope you passed.